I'm Hal Wolf, President and CEO of HIMSS, and Healthcare Information and Management Systems Society is a global nonprofit, an advisor and thought leader with over 80,000 members operating through chapters and communities across the world. At HIMSS, our mission is to realize the full health potential of every human everywhere. And it's our mission to reform the global health ecosystem through the power of information and technology. We have, in effect, pressurized the system. Our senior citizens, especially those with high chronic disease burden, are our most vulnerable population. Geographic displacement has never been under more stress. Hospitals have shut down. In many cases, clinics as well, of basic care. They're starting to reopen, but the challenges were there immediately, and we had to turn to areas like telehealth to support. Funding has recognized that we have gaps in our systems, and the consumers that are now in their home and can't reach their particular doctor or their particular environment for receiving care are demanding the use of new technologies in order to support their needs. And the growing staff shortages have never been more acute. Hospitals basically operate in two shifts, a 12-hour day, maybe up to 14 to 15, that is full throttle, and then an overnight where things are calm, more quiet. But during the pandemic, they've been stretched to 24 hours. And so the staff shortages that existed before, again, have really been pressurized. Digital health and health tech tools and capabilities have long recognized as providing credible support for the most of these challenges. With the pandemic and the advanced tools to date, they've really put the spotlight on the capabilities and the opportunities for digital health. Technology's role in healthcare has expanded exponentially in the last 20 years, but it hasn't kept pace with the social technology advancements of consumerism that other industries have already moved towards, whether it's finance or travel. And frankly, we've had to continue to deal with cultural barriers and sometimes protectionism, which are often to blame for the slower games in a healthcare ecosystem. Let's never lose track of the fact that success in healthcare is always based upon three important needs: people, process, and technology. Those three must come together for us to be successful. Inside our hospitals, we have seen the most rapid adoption and advancement of digital health over the last 20 years in just the last 6 months of the pandemic. And in many cases, the adoption has been successful. The systems and the facilities that already had infrastructure in place and had gone through workforce development advancements found the transition to scale of telehealth and the use of new technologies more easy, and the ability to serve during the pandemic crisis. But many circumstances where providers were uncomfortable with the tools, they have now been faced with the situation of using telehealth where before they may have had caution. And the results are coming in. People are now used to it. Doctors, clinicians, nurse practitioners are beginning to work closely with their customers. We call them the patients, the consumers, the citizens. And so what we see now is the recognition that on a short-term basis, we have significant gains in digital health that are fulfilling the needs and the mantle of our healthcare systems. We're ready to branch out. And government funding is going to be necessary for those systems to exist behind and utilize global leadership, because if the pandemic has taught us anything, it's that innovation must be fed when the timing demands it. One of the examples that I've noted is from a close colleague of mine who works in a hospital system. They have 3 hospitals, and in 2019, they had 1,950 telehealth visits. Today, they're averaging over 2,000 per week. These are the kind of advancements that we've seen. So, what else is going on? Well, the government-coordinated efforts across the globe have focused really on, first of all, social engineering to push down on the pandemic. Stay at home, wear a mask, and manage your personal risk. But technology and information are really having their moments as well. Big data and artificial intelligence are helping to facilitate COVID-19 preparedness and responses. Countries that have mandated and maintained low COVID-19 per capita mortality rates have been sharing their strategies, and you've heard a few of them already, with more to come here at FutureMed. Early surveillance, testing, contact tracing, these are all examples of the uses of big data as well as AI. And the scale of coordination and data management required for effective implementation of these strategies in most successful countries have relied on adopting these digital technologies and integrating them into policy and care delivery operations. Again, people, process, and then the technology. At HIMSS and PCHA Alliance, we've been focusing on interoperability standards, leveraging supply chain solutions, and utilizing data reporting and expanding broadband deployment to address health disparities. Data is ultimately the key. Without it, technology and information simply cannot thrive. In our world of new technologies in the past few months, we see symptom checkers, self-triage tools or e-triage, and it's prime time for the artificial intelligence, with chatbots, for example, are being used in those e-triage and increasingly complex tasks. And finally, we're beginning to see full-fledged focus on 4 of the 5 most valued technologies in digital patient engagement: virtual care solutions, acute virtual care and eICU, patient portals, and remote patient monitoring, which has amazing upside and remains a critical link in future care and when mixed with clinical decision support. The promise of digital health and health technology industry is very strong. The pandemic has shown us that with proper data and information, we can integrate care delivery and a willingness to overcome cultural barriers. We can utilize these capabilities that have been present and drive new healthcare solutions to meet the demands of tomorrow.